Ever feel like picking the right treatment for your aches and pains is a total gamble, especially when it's your spine we're talking about?
Oh, tell me about it.
Well, in today's deep dive, we're going to try to take some of that guesswork out of the equation.
That's good to me.
We're diving into how choosing a chiropractor for spine pain could actually save you a bunch of money in the long run.
You know, what I find really captivating about this whole area of research is how your initial healthcare choices can have this ripple effect. Like, we always get so caught up in the immediate costs, right?
Right.
But it's those hidden costs, the ones that kind of sneak up on you later, those downstream costs, as they're called, that can really make a huge difference.
Okay, so let's break this down. We're looking at a 2024 systematic review.
A really fascinating one, too.
And remember, systematic review, that means they analyze data from a whole bunch of studies, not just one.
Yeah. It was conducted by Faribaugh and their team, and they were specifically zeroing in on the cost of chiropractic care compared to that traditional medical route for adults dealing with spine pain.
And they weren't messing around with the scope of this review either, were they?
Not at all. They dug into data from a whopping 44 different studies.
Wow.
That gives us a much more complete and reliable picture than we'd ever get from just one study.
Okay, so we're talking about a gold mine of information here.
Absolutely.
And it's a good thing they went so in-depth because, let's be real, spine pain in the U.S. is practically an epidemic at this point.
It's true.
You probably know someone dealing with it right now, maybe even yourself.
It's become an unfortunate fact of life for so many people, and a very expensive one, too.
Oh, yeah.
We're talking about a staggering $134.5 billion with a B dollars spent annually in the U.S. alone just to manage spine pain.
It's mind-boggling.
So this research isn't just some academic exercise. It has real-world implications for everyone.
Absolutely. But before we get to the mind-blowing findings about cost savings, let's make sure we're all on the same page about chiropractic care.
Of course. So chiropractic care is all about diagnosing and treating issues with your musculoskeletal system, mainly focusing on your spine. It really emphasizes the incredible ability of your body to heal itself, often without needing to rely on medications or surgery.
So it's about addressing the root cause and working with your body's natural healing power. I like that.
Exactly. It's about finding those misalignments in your spine that might be throwing everything off and using hands-on techniques to get things back on track. And it's not some alternative medicine fad either.
Yeah.
Major medical groups are recommending it, especially for lower back pain. They like that focus on non-pharmaceutical approaches.
Which is a huge deal these days, especially with all the concerns we have around opioid prescriptions.
You hit the nail on the head. And you know what? That's actually one of the areas where this research gets really, really interesting.
Okay, you've definitely piqued my curiosity now. Spill the tea. Did the study actually find that starting with a chiropractor saves money compared to going to, like, a regular doctor first?
So get this. People who saw a chiropractor first for their spine pain actually tended to have lower overall health care costs than those who went to a medical doctor first, yeah?
That's wild. But, like, how much lower are we talking?
Well, imagine this. One of the studies found that people who went to the chiropractor first were 50% less likely to get an MRI for lower back pain early on. And those things aren't cheap.
That makes a lot of sense because chiropractors are all about that hands-on approach, so maybe they're not as quick to jump to those expensive tests like the MRIs and stuff.
Exactly. And remember those hidden downstream costs that we were talking about earlier. There was another study, and it found that going to a chiropractor first for your spine pain made you over 2.5 times less likely to need more intense treatments.
Hold on, over how long?
Over a 5-year period.
Wow. Are we talking about things like specialist visits? Or even like hospital stays? Maybe even dodging surgery?
You got it. All that stuff. And it gets even more interesting when you look at the types of medications that were being prescribed, too.
Oh, this is where the opioid thing comes in, right?
Exactly.
I bet you anything that those who saw a chiropractor first were way less likely to be prescribed those strong painkillers.
You are spot on. This research actually found a significantly lower likelihood of opioid prescriptions among the patients who started their spine care journey with a chiropractor.
Okay, so this isn't just about saving money anymore. This is about, like, potentially life-altering decisions, especially with the whole opioid crisis and everything. If going to a chiropractor can help us turn the tide on that, shouldn't we be shouting it from the rooftops?
Absolutely. This research really highlights a potential path toward curbing the opioid crisis. And that's a conversation we definitely need to be having on a much larger scale.
Mm-hmm.
But it also begs the question, Why are these trends happening in the first place?
Yeah.
What is it about chiropractic care that seems to be leading to these positive outcomes?
Yeah. Like, what's the secret sauce here? So we've seen that seeing a chiropractor first for spine pain could mean saving money and maybe even avoiding those stronger medications.
Right?
But what's the reason behind these trends? Why does this approach seem to lead to such positive outcomes?
That is the million-dollar question, isn't it?
It really is.
This research shows a really strong connection between chiropractic care and these good outcomes.
Yeah.
But we got to remember, just because two things happen together doesn't necessarily mean one causes the other, right? There might be other things going on too.
Okay, so what are some of the thoughts on this? What's the buzz about why chiropractic care might be that effective first step?
Well, one thing is that chiropractors are trained to look at spine health a bit differently.
Okay.
They're more likely to suggest things like spinal manipulation, which has a pretty good track record for some types of spine pain.
So it's like they're getting right to the problem, maybe stopping it from turning into something that needs more serious treatment.
Exactly. And then there's how they diagnose things.
Oh, interesting.
Chiropractors might see certain conditions differently than medical doctors, and that could put patients on a different path right from the beginning.
So it's not really about one approach being better than the other.
Right.
It's about finding what works best for each person and their own needs.
Exactly. And that's why it's super important to remember that this research, while super insightful, isn't a one-size-fits-all answer.
You're right. This isn't medical advice.
Right.
Everyone's different, and it's always best to talk to your own healthcare providers to figure out the best way to go.
Absolutely.
But this research does bring up some really interesting questions.
For sure.
If who we see first can have such a big impact on healthcare costs and treatments, shouldn't we be rethinking how our healthcare system is set up?
Now you're hitting the nail on the head. This research has big implications.
Yeah.
Should we be encouraging a conservative care-first approach to spine pain? Think about it. A system that focuses on less invasive and often more affordable options like chiropractic care before jumping to more intense treatments.
And if those conservative approaches work, it could mean fewer people dealing with the risks and costs of procedures or medications they didn't really need.
Exactly.
It's something to really think about.
It really is.
Well, there you have it. We've gone from those crazy costs of spine pain to how chiropractic care could change the game, all the way to questioning how our whole healthcare system works.
I hope this got you thinking.
We sure did. And we hope you learned something new, too.
Me too.
If you want to dive deeper into the research yourself, check out the show notes for a link to the full Faribault study.
Definitely check it out.
Until next time, stay curious.